Patient safety in emergency situations. Patient armbands may be different colors such as white for a patient identification band, yellow for fall precautions, or red for allergy or no known allergies. Armband colors may not be universal from institution to institution, and any patient transferred from another institution requires a new armband be placed.
Everyone will have a red allergy band. It will either say NKA to indicate the patient has no known allergies, or it will say allergy to indicate the patient does have allergies. This signifies that the patient has been screened. For a specific list of the allergies, one needs to refer to the electronic medical record. Bands are available in the JIT rooms or specifically identified locations on your unit. Please note that writing allergies on the armband is not supported by literature.
A code status order is required for all patients, and you should be sure to be aware of your patient's code status prior to the start of the shift. The electronic medical record is the source of truth for code status. If a patient's code status is unknown, BLS should be initiated until another status is confirmed.
Patient code status categories. A full code indicates that all recovery measures will be implemented. Limited or no CPR indicates that recovery is possible but less likely. Limited allows patients to select which interventions they would receive in the event of emergency. So some of the choices would include no intubation, no non-invasive ventilation, no cardioversion, no internal or external pacemaker, and no vasopressors. Lastly, comfort care only, do not resuscitate, indicates patients receive therapeutic care, no diagnostic evaluations or resuscitative measures performed. Recovery is unlikely.
Code status is present in the patient information header of the electronic medical record. It's visible by clicking into the patient chart. At the beginning of each shift, you should check the patient's code status. It's best practice to know your patient's code status at the beginning of the shift and anytime there are changes. If your patient is having a medical emergency, call for assistance and notify the nurse immediately. In some departments, there are terminals that can be activated on the wall. You should also use voice communications to call the operator for overhead paging. Be sure to state whether it's a rapid response or code blue plus the location. Ultimately, you should follow the process communicated during just-in-time orientation. If your patient is full code and not breathing or has no pulse, start high-quality chest compressions. Remember, the number to call for a medical emergency will be different hospital to hospital. Chest pain is a common condition that may impact your patient. If a patient complains of chest pain, notify the nurse immediately. A rapid response may be called in this situation. You may also anticipate that the nurse may ask for an EKG. If your patient suddenly or unexpectedly exhibits one or more of the following symptoms: trouble walking, trouble speaking, weakness on one side, or trouble seeing, call for assistance immediately. This is a medical emergency, as it may be a stroke. Other codes or emergencies may be paged overhead. These could be emergencies such as fire, armed intruder, severe weather, or a behavioral emergency. Code names will vary from hospital to hospital. Review all hospital emergency codes and unit-based actions to those codes at the beginning of each shift. This is included in your just-in-time tool. Refer to your emergency code sheet for a quick reference.